Well, the Royal College is a membership organisation, so primarily we are supporting members because they keep the college going by paying their annual fees, and they're also an important part of the volunteer network that we desperately need to survive. There are many challenges across pathology, so while we help all aspects of pathology through training, through CPD, through guideline support, we also play an important role in lobbying government and interacting with government to ensure that pathology is not forgotten about and is supported financially. Key here is to try and address the imbalance that's been created between workforce and the workload we're expected to bring about, because in the future that workload is going to increase because we've got demographic changes, we've got advances in healthcare, and we've got increases in things like cancer, which will undoubtedly put pressure on the service. So we need to focus on both the demand side of it, but also have a close look at what things we can do to make more out of the workforce that we have, because it's unlikely that we're going to be able to financially train more individuals that work in pathology services in the short term, and we need to try and make do and retain everything that we currently have and make people work differently. Digital pathology is key going forwards. It will enable not only the storage of images that we can then send away across the rest of the UK and even beyond that, but it will ensure that we have permanent records in place that can be looked at for research and innovation purposes. In terms of the workload challenges, digital pathology will also enable work to be carried out slightly differently. It will enable pathologists to work effectively anywhere in the world, working at home in particular, in order to make the most out of their time. So digital pathology and investment in it is going to be key for all pathology services to be able to maintain and deal with the workload that they currently get and are going to increase going forwards. The days are gone where pathology services can work in isolation. They need to work across networks, they need to collaborate, they need to ensure that there are methods that enable them to engage with other services. That interoperability is going to be key, and standardisation of nomenclature, for example, and the ways in which we report is also going to be a big part of that. But the collaboration goes way beyond pathology services. It needs to include industry more and more, because that is where we're going to see a stronger voice lobbying for pathology, and also to enable new solutions to be implemented that will make a difference.